According to UNAIDS, HIV-related stigma refers to negative beliefs, feelings, and attitudes towards people living with HIV. And HIV-related discrimination is the unfair and unjust treatment of an individual based on his or her real or perceived HIV status. Hello and welcome to another episode of The Last Mile with NACA. I'm Adesuwa Osui. HIV stigma today is rooted in a fear of HIV images that first appeared in the early 1980s. Thus, the lack of information and awareness combined with outdated beliefs leads to negative value judgments about people who are living with HIV. Stigma and discrimination have become major barriers militating against the national response to the epidemic. You are watching The Last Mile with NACA. Don't go away.
My husband had to leave the house, leaving me with my 6 children that I'm HIV positive, that I will die and leave the children. My family, everybody had to send me away. I had to squat in the church without the pastor knowing my status, because had it been the pastor knows my status, he could have sent me away.
I told my boyfriend my status, of which he accepted that he wants to keep it a secret, and he accepts me being like that. But as time went on, he started abusing me, that I got it through prostitution, and I told him my real story, that it was through blood transfusion, which I accepted the first time, and he told my classmates.
HIV-related stigma and discrimination is a significant problem globally and poses complex barriers to prevention, testing, treatment, care and support for people living with or at risk of getting HIV.
It's not only HIV services that we provide in terms of treatment, in terms of testing. No, there is this campaign against stigma and discrimination that we want to take to every communities. We want to make sure that people understand the message first, and if they understand the message, the issue of stigma and discrimination doesn't even arise. And the message is the HIV has changed. HIV is no longer killing people as it does in the past, and it's no longer giving people the bad look it gives in the past. And why? Because these drugs that patient takes they're working very well. They eliminate the virus from the blood. So when they eliminate the virus from the blood, they prevent the virus from leaving the person that has it to go into another person. And within the person that has it, this drug prevents the HIV from breaking their body defense. So it is the failure of the body defense that usually make individual vulnerable to all sorts of infections that you see. It's not actually the HIV that gives somebody that bad look, but the complication of HIV.
When I discovered that I'm positive, I was age 10 years old. As for them, my family were like putting me aside among the family. If we are eating now, I will not eat with the other family again. They will give me my own plate, my own spoon, and the rubber that I used to bath is always different with these other ones. And where I, like the bathroom now, I will not bath where other people are bathing. So I felt bad that why is it that they are treating me like this?
HIV-related stigma prevents individuals from learning their HIV status, disclosing their status even to family members and sexual partners, or accessing medical care and treatment, weakening their ability to protect themselves from getting or transmitting HIV.
People with HIV live normal life. They work as productive as any member of the community, and among them are intelligent people, hardworking people. Why should we discriminate against them? And more so when these drugs are available, why shouldn't we encourage every member of the community to know their HIV status and come and take this drug? It is people who don't take this drug in the community that are giving the virus to others. It is people who don't take this drug that are coming with that bad look. If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful.
to protect people living with HIV and AIDS from stigma and discrimination, as well as to mitigate the negative impact on effective prevention and care programs, Anti-Stigma and Discrimination Act was enacted in 2014.
Discrimination actually is still very, very rampant and pervasive in Nigeria, and it affects virtually every sector of the country. A lot has been done to address the issue of stigma and discrimination. First, the country came out with a law that's try as much as possible to place some bit of sanctions and also to act as a deterrent for people living with HIV not being discriminated against. And the country also went ahead to produce a strategy that tries as much as possible to guide implementation of interventions to address that.
The act came up because there was need and outcry, because HIV epidemic is being looked now, viewed as an human rights issue, and we found that there were so many discrimination all over the place, stigmatization against people living with HIV/AIDS. And because of that, the agency, together with Federal Ministry of Justice and MDUs, we came together to put forward to the National Assembly. It took a long process, but it eventually was passed into law in 2014.
Civil society groups also play a pivotal role in ensuring that the menace of stigma and discrimination is curbed.
Our role as civil society is to be the voice of the voiceless, and we also keep telling everyone, if you have been discriminated against, or someone has stigmatized you and you try to put the word across to the person and they are still not hearing or they are still not listening to you, be it an organization, be it an entity, be it a church, be it whatever form of entity it is, come run to us. We will give you the voice that you need. Like what the case we're handling now in Delta State, where a nurse had to disclose someone's HIV status. Though the nurse has relocated to Canada, we are informing the immigration authorities that this nurse has a case to answer.
Tine Emmanuel, she is an air hostess who has been rejected from her workplace, but we are able to advocate and ensure that her job is restored, and also make a case on her behalf. And the federal government had to force that organization to ensure that that woman, she and her baby that they have exposed to stigma, because if a mother is being stigmatized and being exposed to the general public about her HIV status, that is mean the impact will not live only within her, but it will go to her family. And on that regard, we're able to advocate, and the children she gave birth to have been sponsored to go to school, and that is one of the key successes I've mentioned. And there are others within the hospital setting. Recently, I received a report from Plateau here, one nurse, Justina. She has also experienced such kind of thing, and she ran to us, and we're able to engage with the hospital management, and we told them that if you don't do ABC, we are going to sue you to court. So they have to beg and try to see her and restore her dignity.
So beyond just one voice, if your voice is not heard, which most times cannot be heard because we have 198 million people in Nigeria, we have that voice all over the country to give you the voice. That's the role we play against stigma, because we have said that we must stamp out stigma out of Nigeria, and we must stamp out discrimination out of Nigeria at all costs. It's our responsibility. The legal framework is already there, and it's our responsibility as civil society organization to continue to pressure and to be the watchdog role we have to do, to pressure on every entity to do the right thing, which is we do not discriminate against someone irrespective of their HIV status.
Since the enactment of the Anti-Stigma and Discrimination Act in 2014, how has the awareness level among Nigerians been impacted?
You can, as of right, institute an action on your own. But the thing also is that when you do not know or know that there's a law that protects you, it's difficult for you to institute an action. So that's the area that NACA has been doing. We have been doing advocacy in that regard to enlighten the public, and especially people living with the virus.
The knowledge about the law is not more than 25%. That there's even a law, the anti-stigma law, is no more than 25%. Then the knowledge of the content of the law is no more than 5%. Because at each point we have conversation with people, are you aware about this law? Some say yes, we're aware. then do you know what the content is? Many people do not know. So it's only when we get feedbacks that people have been rejected from their workplaces. So we know what we are going back now is go back to all the stigma and discrimination campaigns that we usually carry before, to say everyone, hey, you need to be aware of that again. Probably tease out tidbits of the stigma law and start pushing it to the social media, start pushing it to the electronic media, to the print media, and of course through interviews to tell everyone we need to come back and read what the law actually says, so that you don't go and commit an offense.
We are having a lack of knowledge interpretation. When we have such kind of document, there is need for domestication as well. When we have it at the national, we also have state legislatures. The state legislators are also expected to domesticate that at their various states, so that a layman or woman who doesn't even understand English can be able to understand what is written. And with the support of NACA and AHF, we are able to also develop a local version that speak around this stigma and discrimination document.
Stigma and discrimination manifests itself in many settings. Some people living with HIV and other key affected populations are shunned by family, peers, and the wider community, while others face poor treatment in educational and work environments.
Discrimination actually takes place at home, takes place in the church, takes place in the community, takes place in schools, takes place in the workplace, takes place everywhere. And so we need to really continuously speak about this issue of stigma and discrimination, and also let people know that you could be discriminating against somebody without even being conscious of it. So there are some unconscious discriminatory behavior and practices that takes place. So people need to be aware of that.
The fact that church committees have come out to say that people should not wed because of their HIV status. We have had it as a point of our duty to even put across the right information to them, to say, by the anti-discriminatory law, it's against what it says. The only thing the partner needs to do is to inform the other partner, and once the partner gives consent, you as a church wedding committee, you do not have the right within the ambit of the law to ask or to say, I'm not going to wed someone who is HIV positive. Then there's also this issue of every entity is mandated not to conduct HIV tests for new employees. Meanwhile, almost all entities in Nigeria do that test. It's already an offense before the law that is punishable.
And this is one aspect that a lot of them are not aware, that some of them breach the provisions of the Anti-Discrimination, Anti-Stigma and Discrimination Act, is that it must be a consent. You must receive the consent. There must be an informed consent of the applicant or employee before you go ahead and subject that person to an HIV/AIDS test. So you need to always check that you are in compliance with our law.
People living with HIV who have been stigmatized or discriminated against can call NACA on 6222 for legal guidance and support.
What we want people to know is that there is an act against HIV, stigma and discrimination. If people are treated unfairly as a result of their HIV status, positive HIV status, they have a right to complain. And we have lawyers that provide services free of charge for these clients. All we want is that individual to report to us that they have been discriminated, unfairly treated because of their HIV status, and we will act.
Stigma and discrimination towards people living with HIV simply forces the epidemic underground, creating the ideal conditions for HIV to spread. Let us support NACA and stamp out HIV stigma from Nigeria.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word.
The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
The update segment is next, with NACA's activities in Nigeria and elsewhere. Stay with us.
The National Agency for the Control of AIDS, NACA, recently organized a governance and leadership workshop for its management staff and governing board members. The Director General, NACA, Dr. Aliyu Gambo, delivered the welcome remarks.
I think a very timely engagement to have the NACA governing board and the NACA management team seated together for this training. And I hope after this training, will be better for it management and leadership wise.
The opening was delivered by the chairman of the NACA governing board, Senator Oladipo Odujiri.
Capacity training is important in any organization. And it's also important that with this kind of interaction, coming together with management and also getting properly briefed and trained by experts in relationship management in our journey of providing leadership to NACA and in the process of ensuring that the people we are supposed to cater for, our brothers and sisters who are living with the virus, get adequate attention and will reduce the number of fatalities in this area.
There were paper presentations by the Principal Facilitator, Olusegun Adekunle, Deputy Director, Policy Planning and Coordination, NACA, Dr. Effion Eno and Alex Ogundipe, Director, Community Prevention and Care Services. Some of the participants shared their experience.
It is to bring governance and leadership to the forefront of affairs of managing the mandate and the responsibilities of NACA, because leading, directing, steering remains a recurring issue in our national life. We have looked into the operations of NACA, during which we emphasized code of conduct, we emphasized integrity, we emphasized leadership, and we emphasized the fact that policy initiation, implementation and oversight all combine to make the responsibility for delivery of service very, very important.
The key importance of this meeting is building the capacity of both governing board members and executive to smooth in the interactions and the way we work productively to move the agency forward. It's very critical because these are the management team. These are the people that make things happen, not just for NACA, but in the national response to HIV and AIDS. And if you can eliminate rancor, if you can eliminate conflict, if you can eliminate wrongdoings, then it means people can settle down and hunker down and do the job properly for the glory of Nigeria through the national response.
The importance of the workshop is to help NACA to move ahead and to help the management as well to know the areas they will touch on, to help also the board to know our next line of action as regards working as a team, because when the board, the management work as a team, there's always a progress.
The workshop was highly interactive as salient questions were asked which were duly answered by the facilitators.
What we want people to know is that there is an act against HIV, stigma, and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a #1 enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. And that's our package for this week. And please continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I'm Adesua Osui. Goodbye.